Guys, welcome to another video. Today we'll be talking about melanoma. We'll be covering the types of melanoma, diagnosis, treatment option, and preventative measures. So let's get started. Melanoma is a type of skin cancer that arises from the pigment-producing cells in the skin called melanocytes. It is the most dangerous form of skin cancer and can spread to other parts of the body if not caught and treated early. The exact cause of melanoma is not known, but it is believed to be a combination of both genetic and environmental factors. Exposure to ultraviolet radiation from the sun or tanning beds is a major risk factor for developing melanoma, as is having a history of sunburns or a large number of moles on the body. Other risk factors include having fair skin, a family history of melanoma, and a weakened immune system. Symptoms of melanoma can include changes in the size, shape, or color of an existing mole or the appearance of a new, unusual looking mole on the skin. Melanomas are often asymmetrical, have irregular borders, and may be multiple colors. They may also be itchy or bleed. If you notice any suspicious changes in your skin, it is important to see a dermatologist for an evaluation. Early detection and treatment of melanoma can greatly improve the chances of a successful outcome. Now we will be covering the types of melanoma. There are several types of melanoma that can affect the skin, and each has its own characteristics and treatment options. Here are four main types of melanoma. First is superficial spreading melanoma. This is the most common type of melanoma, accounting for about 70% of cases. It typically starts as a flat, irregularly shaped mole that gradually grows and changes over time. It can appear anywhere on the body and is most commonly found on the legs, back, and arms. Next is nodular melanoma. This type of melanoma accounts for about 15% of cases and tends to grow more quickly than other types. It often appears as a raised lump that is dark in color and can be firm or spongy to the touch. Nodular melanoma can appear anywhere on the body and is often found on the head, neck, or trunk. Third is lentigo maligna melanoma. This type of melanoma is more common in older adults and usually appears as a large, flat, discolored patch of skin that has irregular borders. It is often found on areas of the body that have had a lot of sun exposure, such as face, neck, and arms. Fourth is acral lentiginous melanoma. This is the rarest form of melanoma and accounts for only about 5% of cases. It typically appears as a dark, irregularly shaped patch of skin on the palms of the hands, soles of the feet, or under the nails. It is important to note that there are other less common types of melanoma as well. The type of melanoma a person has can affect their treatment option, so it is important to have it properly diagnosed by a dermatologist or other healthcare professional. Now coming to the diagnosis. Catching melanoma early is crucial for successful treatment outcomes. Here's an overview of how melanoma is typically diagnosed and staged. First, if a dermatologist suspects that a mole or other skin lesion may be melanoma, they'll perform a biopsy to remove a small sample of the skin tissue for examination under a microscope. There are different types of biopsies that may be used depending on the suspected type of melanoma and its location. Once a diagnosis of melanoma is confirmed, doctors will perform further tests to determine the extent of the cancer and its stage. This may include imaging tests such as CT scans or PET scans, as well as blood tests to check for signs of cancer. The stage of melanoma is determined based on several factors, including the thickness and depth of the tumor, whether it has spread to nearby lymph nodes or other organs, and whether there are any genetic mutations that may affect the treatment options. The staging system for melanoma is called the T&M system. T refers to the thickness of the tumor, N refers to whether the cancer has spread to nearby lymph nodes, and M refers to whether the cancer has spread to distant organs. The staging system requires from stage 0 melanoma in situ, meaning it has not spread beyond the top layer of the skin. Stage 0 means that the melanoma has not spread beyond the top layer of the skin. Stage IV, melanoma has spread to distant organs. Stage 4 melanoma means that it has spread to distant organs. Knowing the stage of melanoma is important for guiding treatment decisions and determining the patient's prognosis. It is important to work closely with the healthcare team and follow all recommended screening and monitoring guidelines to catch melanoma early and ensure the best possible outcome. Treatment for melanoma will depend on several factors, including the stage of the cancer, the size and location of the tumor, and the patient's overall health and preferences. Here are some of the main treatment options. First is surgery. Surgery is the primary treatment for most cases of melanoma. The goal of surgery is to remove the tumor and any surrounding tissue that may be affected by the cancer. In some cases, lymph nodes may also be removed to determine if the cancer has spread. The extent of the surgery will depend on the size and location of the tumor as well as the stage of the cancer. Second is chemotherapy. Chemotherapy uses drugs to kill cancerous cells. It is typically used for advanced or metastatic melanoma that has spread to other parts of the body. Chemotherapy can be given orally or intravenously and may be combined with other treatments. Third is radiation therapy. Radiation therapy basically uses high energy X-rays to kill cancerous cells. It is typically used for melanoma that has spread to nearby lymph nodes or for tumors that cannot be surgically removed. It may also be used after surgery to reduce the risk of the cancer returning. Fourth is immunotherapy. Immunotherapy works by boosting the body's immune system to help it fight off cancerous cells. This can be done through drugs called checkpoint inhibitors, which block proteins that inhibit the immune system, or through drugs that stimulate the immune system to attack cancerous cells. Immunotherapy is becoming an increasingly common treatment for advanced melanoma. Other treatments for melanoma may include targeted therapy, which uses drugs to target specific genetic mutations that are driving the growth of the cancer, or clinical trials of new or experimental treatments. The choice of treatment again will depend on several factors, including the stage of the cancer, the patient's overall health and preferences, and the potential benefits and risks of each treatment. It is important to work closely with a healthcare professional to develop a personalized treatment plan that is right for you. Finally, coming to the preventative measures. Preventing melanoma and catching it early are key to reducing the risk of developing this type of skin cancer and achieving the best possible outcomes. Here are some ways to prevent melanoma. First is protect your skin from the sun. Exposure to UV radiation from the sun is a major risk factor for developing melanoma. To minimize your risk, it is important to protect your skin from the sun by wearing protective clothing such as long-sleeved shirts and wide-brimmed hats, and using sunscreen with an SPF of at least 30 that protects against both UVA and UVB rays. It is also important to avoid tanning beds, which can increase your risk of developing melanoma. Second is performing regular skin checkups. Checking your skin regularly for new or unusual moles or spots can help you catch melanoma early. Use a full-length mirror and a handheld mirror to check all areas of your body, including hard-to-see areas like your scalp, back, and buttocks. Look for moles or spots that are asymmetrical, have irregular borders, are multiple colors, or have changed in size or shape. Third is see a dermatologist. If you notice any new or unusual moles or spots on your skin, or if you have personal or family history of melanoma, it is important to see a dermatologist for a skin examination. A dermatologist can perform a thorough examination of your skin and may recommend a biopsy if they suspect melanoma. Fourth is knowing your risk factors. Understanding your risk factors for melanoma can help you take steps to prevent it. Risk factors include having fair skin, a history of sunburns or tanning bed, use, a family of history of melanoma, and having many moles or atypical moles on your body. Fifth is stay informed. Stay up to date on the latest recommendation for preventing and detecting melanoma by talking to your healthcare provider and staying informed through reliable sources such as the American Cancer Society or the Skin Cancer Foundation. By taking steps to protect your skin from the sun, performing regular skin checkups, and seeing a dermatologist if you notice any changes in your skin, you can reduce your risk of developing melanoma and catch it early if it does develop. Finally, melanoma is a serious form of skin cancer that can be life-threatening if not detected and treated early. By learning about the risk factors, symptoms, and preventative measures, you can take steps to protect yourself and your loved ones. Remember to always wear sunscreen, avoid tanning beds, and check your skin regularly for any changes or unusual growths. If you do notice anything concerning, make an immediate appointment with your doctor or dermatologist right away. By taking these simple steps, you can reduce your risk of melanoma and enjoy a lifetime of healthy skin. Thank you all for watching, and I'll catch you in the next video.